and stretch for quadratus lumborum. This is the right quadratus lumborum that we're going to be doing a pin and stretch for, which is part of your treatment. So I haven't given Hannah a pillow because I want that upper body to be quite level. I don't want her coming up into a laterally flexed position in her body, because that's going to shorten the QL up there. I'm going to get you, Hannah, just to wriggle back towards me with your bottom. So just your bottom, your upper body can stay where it is. That's it. And you may want to hold on onto the edge of the table there. Okay, so I've got my leg braced against the table, which is bracing her hips so that she's going to feel supported and not fall. And then if you could just bend this bottom leg up, that's it. And the idea is that this leg here is going to come down off the edge of the table into adduction and back up into abduction as part of the assisted technique. So just bring your leg up for a second. That's it. To pin the quadratus lumborum, I have to find my, my borders of that, and I'm going to go right into the belly of the muscle. So we've got attachments up onto that 12th rib there, first 4 lumbar vertebra, and over onto the iliac crest. So I'm just imagining that it kind of sits in this position here with the fibres coming up that way. So I'm going to pin right into the belly of the muscle. So I have to come out past the erector spinae to be able to access that quadratus lumborum, going in with thumbs. And then I'm going to get Hannah to take a breath in, and as she breathes out, I'm just going to increase that pressure and compress that quadratus lumborum down with my thumbs. So I've pinned the QL down on with a digital ischemic pressure in the belly of the muscle. And then, if you can just bring this leg back off the edge of the table, that's it, just straighten it out if you can, that's it, and wriggle back just a little bit more, I think. Yep, that's it. Okay, so we need to have the leg off far enough off the edge of the table that the femur and the knee's not going to keep hitting the table. Okay, so I've pinned that down, and then I'm going to get Hannah to bring the leg up into abduction, nice and slow, and then down, all the way down off the edge of the table into adduction, which is the lengthening part of the muscle. And bringing it back up, and we do that about 2 or 3 times, and then all the way down. And one more, and all the way down. Okay, and bringing your leg back up onto the table, and then I release the pinned part of the quadratus lumborum, and then get her to move back in to the edge of the table. And that's the pin and stretch for QL.